All right, today we're diving into some really unexpected tools for our mental health. We're going to open up a toolkit that's filled with everything from ancient wisdom to cutting edge tech. It's pretty wild stuff. Let's get right into it. So, what do brainwaves, ancient roots, and your neighborhood have in common? I know, it sounds like the beginning of a really weird joke, right? But believe it or not, these things are all connected. And here it is. They're all powerful tools, levers we can pull to actually shift our mental well-being. We're going to start inside our own heads, then look at some substances that can either help or hurt, and finally, we'll zoom way out to the world all around us. First up, let's talk about hacking your own body, because honestly, the most powerful tool you have is the one you're carrying around with you 24/7. And you might be kind of shocked by how much you can actually learn to control. The secret here is this really cool technique called biofeedback. Okay, think of it like finally getting the owner's manual for your own body. It's a way to learn how to consciously dial down your heart rate or release tension in your shoulders. All that stuff we usually think is totally automatic. So how on earth does it work? Well, you get hooked up to these little electronic sensors that can pick up on super subtle changes in your body. And then that information gets fed back to you in real time. So imagine hearing a sound that gets deeper and calmer as your heart rate slows down. You're literally watching and hearing your body respond to your thoughts. It's amazing. The whole training process really breaks down into 3 stages. First, you just become aware. You start to notice, oh wow, when I think about that stressful thing, my shoulders tense up. Then, with the help of those sounds or visuals, you learn to actually control it. But here's where the real magic happens, the 3rd step. That's when you take that skill with you out into the real world, so you can calm yourself down in the middle of a traffic jam. No machines needed. Okay, so we've seen how we can literally train our own minds. But what happens when we start introducing things from the outside? Now let's get into the world of chemical tools, some of which can be keys to unlock wellness, and others, well, they can be a total curse. You've got 2 completely different ways of thinking here. On one hand, you have aversion therapy. This uses a drug like disulfiram, which basically makes you violently sick if you drink alcohol. It's training your body to hate it. On the other hand, you have something like ginseng, which is all about adaptation and support, boosting your energy, helping you manage stress. It's really the stick versus the carrot. And look at this contrast. You've got a modern, lab-created pill designed for one specific negative purpose, and then you have this ancient root that's been used in traditional medicine for over 2,000 years for all-around support. Both are chemical tools, just from completely different worlds. But, not all of our chemical encounters are on purpose. Sometimes the problem isn't something we choose to take. Sometimes it's something hidden in our environment, acting like a chemical curse. Lead poisoning is the perfect example. And what's so scary is how everyday the sources can be. We're talking about peeling paint in an old house, dust from the soil, even old water pipes. Things you've never even think about. But that constant low-level exposure can have a huge impact, especially on kids, causing learning and behavior issues. It's a really powerful reminder of how connected our mental health is to the physical world. So that brings us to our last big idea. If the environment can cause harm, well, guess what? It can also be an incredible source of healing. Let's look at how the actual systems around us can be re-engineered to help us. 7.1 days. What is that? Back in 2007, that was the average time someone spent in an inpatient psychiatric hospital. For a really long time, the main solution for a crisis was to just remove the person from their environment entirely. But the number of those hospitals has been going down for decades. And that's not just a statistic, it points to a huge shift in how we think about care. We're moving away from locking people away and moving toward treating them right inside their own communities. So what does that new approach look like? Well, one really powerful answer is something called multisystemic therapy, or MST. The idea is simple, but it's also pretty radical. Instead of pulling a kid out of a so-called bad environment, you bring the therapy into that environment and fix the problems where they start. So this means therapists are meeting families in their living rooms, in their schools. They're on call 24/7. And the goal isn't just to put out fires. It's to actually give parents the tools to handle future problems themselves. Think about it. It's the difference between sending a kid away for skipping school and having a therapist work with the family on their communication and with the school to figure out, say, a bullying problem. You're strengthening the whole system. So after all that, what's the big takeaway?
We've gone from the inside of our own skulls to chemicals from nature and labs, all the way out to the communities we live in. It's time to put it all together.
What we're seeing is that the modern toolkit for mental health is just huge and diverse. It means we have to look inward and learn to hack our own biology with things like biofeedback. It means looking at what we put into our bodies, whether that's an ancient herb or a modern medicine. And, so importantly, it means looking outward to build better, stronger systems of support right where we live. I mean, when treatment can come from your own thoughts, from a root that's thousands of years old, and from your own social network, it just completely shatters that old, one-size-fits-all idea of mental health care. It points to a future that's way more personal, way more holistic, and hopefully way more effective. So it makes you wonder, what other unexpected tools are we going to discover next?